My name is Moritz Seiffert. I'm an interventional cardiologist, a professor of cardiology at the Ruhr University in Bochum, Germany. The DEDICATE trial is a basically all-comers trial comparing SAVR or TAVI in a low to intermediate risk population. Over 1,400 patients were randomized to either SAVR or TAVI. Patients had to be low to intermediate risk, about 65 years old. And the heart team was at the heart of this trial, and basically decided on the eligibility, and also decided on the choice of the device and on the procedural care according to the assigned treatment options. Then patients were followed up to 1 year. Co-primary safety endpoint was all-cause death or stroke at 1 year. And this was the primary outcome of this analysis, and patients will be followed on for 5 more years for the primary efficacy outcome of death or stroke at 5 years. And then it's not going to be only non-inferiority, but at that time point, if this is applicable, also superiority will be tested. For the primary outcome, TAVI was non-inferior to SAVR with regard to the primary endpoint, all-cause death or stroke, with a hazard ratio of 0.53. But even more so, some of the secondary endpoints and also components of the primary outcome, for example, all-cause death, the event rate was significantly lower in the TAVI arm compared to SAVR. So I think the clinical implications of the DEDICATE trial, that in addition to the evidence that we have so far within the 1 year time frame, really have a strong argument also towards catheter-based treatment in these younger, low-risk patients. As opposed to previous trials, DEDICATE is independent, just sponsored or just funded by academic research institutions, and all devices were allowed, right? So that's really something new, and really gives us confidence as these patients were as close to clinical routine care as we can be. So I think particularly for this younger, lowest patient population, long-term data will be essential. So we'll have to look at 5-year, at 10-year time frames to draw final conclusions on the question TAVI or SAVR for this patient population. So this is still an ongoing trial, and we'll do further follow-up, and this will be really important for the data.